to say. Covers a lot more territory than just this. This is probably an easy thing, relatively speaking, for you. I would like you to speak to the medical doctors to see if there's any way that you can apply light and heat to cure. You know, that if you could, and maybe you can, maybe you can't. Again, I say maybe you can, maybe you can't. I'm not a doctor, but I'm like a person that has a good, you know what.
But sir, you're the president.
Deborah, have you ever heard of that? The heat and the light relative to certain viruses, yes, but relative to this virus?
Not as a treatment. I mean, certainly fever is a good thing. When you have a fever, it helps your body respond. But not as, I've not seen heat or light.
I think it's a great thing to look at. I mean, you know. Okay?
Respectfully, sir, you're the president, and people tuning into these briefings, they want to...
A question that probably some of you are thinking of if you're totally into that world, which I find to be very interesting. So, supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light, and I think you said that hasn't been checked, but you're going to test it. And then I said, supposing you brought the light inside the body, which you can do either through the skin or in some other way. And I think you said you're going to test that too. Sounds interesting.
Get the right folks who could.
Right, and then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number on the lungs. So it'd be interesting to check that. So that you're going to have to use medical doctors with. But it sounds interesting to me.